All right. Good morning, everyone, and welcome. We're just about 10 a.m. here. We had a bunch of people register for today, so it's great to see most of them online so far. And I'm sure we might get some latecomers at some point during the meeting. So I'm also going to just record today's session in case anyone was late to it or registered and wasn't able to attend. I'll share that link with them afterwards. So good morning, everyone. You're in the right place if you're here for our pelvic floor therapy topic with Alison. Alison, thanks for joining us online today. Just to get us started, my name is Connie Butera, and I am your local community manager for Life with a Baby York Region North chapter. One of the great things about COVID and all of us sort of working from home is that we might have other members from other chapter areas joining us here today, which is awesome. So my chapter area covers Newmarket, Aurora, East Gwillimbury area, as well as Georgina. But you may be joining us from a Life with a Baby chapter outside of that area. So if so, welcome. I am a local mom of four, as well as a volunteer with our organization. I'm the one behind the scenes that plans all of the events for Life with a Baby York Region North. So very nice to meet you. If I haven't met you personally, I know we're in some unprecedented times, and normally I'd be seeing my members weekly at local play dates and circle times and within the community. But given everything that's going on, we've sort of switched to an online model these days. So we're really, really appreciative for our community partners like Alison, who have volunteered to join us today to present on a topic from home. So just to give you a little bit of background in case you're new to our organization, Life with a Baby is a program of the Life with a Baby Foundation. We are a charitable organization, and we provide fun social events, workshops, seminars, and programs such as this one for families of children, mostly for children ages 0 to 6 in the community. We also now have a preteen program as well as a preterm program for moms of preemie babies. And so that's a little bit about our organization. We also have a sort of an underlying mission that we follow, which is to help moms who are going through postpartum depression, and to help prevent that and to help moms going through that. And we do that through our peer-to-peer support model, which is essentially getting families out, getting them enjoying, time with their baby out in the community and creating that village. If you have any questions following today's session, you could feel free to reach out to me. That's my email and my phone number, as well as our website where you can see other events that are available in the community. So at this time, if you just bear with me for 1 second, I'm going to hand over the Zoom host privileges to Alison, our lovely speaker for the day. There she is. So I am going to make her a host now. And then she can take it from here, and I'm going to come off of video and camera myself, and I'll be sort of in the background recording. So thank you once again, everyone, for joining us today, and I'm going to pass it over to Alison, our host.
Thank you, Connie. Thanks for that wonderful introduction. So as Connie said, my name is Alison Ribeiro, and I am a physiotherapist. I'm a pelvic health physiotherapist as well as an orthopedic physiotherapist, and I work in Newmarket as well as Keswick. And the topic for today is essentially everything you'd like to know about pelvic floor, pelvic health. So in this sense, what I'd love for everyone to do is, if you're not familiar with Zoom, there's a little icon at the bottom of the screen that's a little chat bubble. I'm just curious as to who we have joining us today. So if you wouldn't mind, in that, click on that chat bubble, and in the message there, make sure it says to everyone. I'd love for you to let me know if you have any specific questions that you would like me to address for today, or any specific goals that you're hoping to achieve by coming to this session. So if you're curious about anything specifically, I would love for you to type that in there so that I can make sure that I address your specific concerns for today. The other piece that I'd love to know is kind of where you're at. So if any of you are currently expecting, if any of you have children at home, and if so, kind of what age your kiddies are. I'd love to know a little bit about that. So what I'm going to make sure I do here is, okay, so how do you know you need to work on your pelvic floor? Awesome. We will touch on that. Rebuilding after birth. Love it. Where is the pelvic floor? Very good question. Some people might have an idea, but we'll go over that. Do Kegels help with incontinence? Okay, so I'm going to make a note. We will definitely talk about that. Is it too late? Okay. 8 months, preparing for birth for second. Awesome. Congratulations. And okay, yep. So a little bit of incontinence, currently postpartum. Beautiful. Okay. Awesome. So again, if I touch on, as I talk, if you have any questions about anything, please feel free to type it into that chat box. And if for some reason I miss it, I'll have an opportunity for questions and answers at the end. And please remind me at that point if there are any, if I haven't touched on your specific concerns. Okay, so a little bit about me. So as I said already, you already know that I am a physiotherapist. I myself am a mom of 2 boys. I have a 4-year-old and a 22-month-old. My experiences with labor and delivery were different for both of them. For my first, we found out he was breech when I was already partway through labor. So that turned into an emergency C-section, which is definitely a surprising thing for me. I was not expecting that at all. And then my second was a successful VBAC, TOLAC, whatever you want to call it. It's a vaginal birth after cesarean or a trial of labor after cesarean. They use both different terms. So I have had a C-section. I've also had a vaginal birth as well. So I have a little bit of personal experience in both areas, and I am more than happy to answer any questions that you may have specifically on those things as well. So in order to really fully understand what we're going to be talking about today, I'd like to start off with the general anatomy of the pelvic floor. So that will help to answer where is the pelvic floor? So I have a couple of little models here. So this is a model of your pelvis, okay? So when we look at this is the front of your pelvis. We'll turn it around here, and this is the back of your pelvis, okay? This here is the lower part of your spine. This is your sacrum, and you have right here your tailbone right there, okay? So when we look at this, what you'll see is we have 3 main joints in our pelvis. So one right here at the front, okay? And one on either side here at the back, okay? This one at the front is commonly referred to the pubic symphysis. Some of you in your pregnancies may have experienced some discomfort right in through kind of the front of your pelvis. That might come from this area. We also have these 2 joints at the back. These are commonly referred to as the SI joints. Again, these are a common area of discomfort during pregnancy. Now, why might that be? So during pregnancy, we have a number of lovely hormones that course through our bodies, right? Now, these hormones have a purpose. These hormones help to relax the ligaments in our bodies. The purpose for that is that we need our bodies to be able to adapt and to a growing baby, right? The challenge with that is that we have some rather thick ligaments that go across these joints here through the back of our pelvis. And those ligaments are meant to help to support and stabilize our pelvis. Now, if you imagine if they are now a little bit more lax, right, that these joints here need a little bit of help from other surrounding structures to help with that stability. So that now falls to the muscles in through the low back on either side of the spine, the glute muscles, your bum muscles on either side, any of the muscles that attach into the pelvis here. So that can include the muscles in through the front of your thigh, the back of your thigh, the inner portion of your thigh. All of those muscles come up and attach into different areas of the pelvis here. So those muscles, including the pelvic floor muscles, help to make up for that. So these here are the muscles of your pelvic floor. Okay, I'll try and give you a little zoomed in view there. So this here is the front. This is the back. This here is the vagina, and this here is the rectum. Okay, so as you can see, there are a lot of muscles in the pelvic floor there, and they attach to several different areas in through our pelvis. So these muscles actually sit inside of your pelvis, like that. essentially like a bowl, okay? So that is where your pelvic floor is. It literally is the floor or the bottom of your pelvis, okay? Now, your pelvic floor itself has several different functions. So some of the main functions are these muscles help to hold up your bowel, your bladder, and your uterus, okay? These muscles help to keep you continent, so to prevent you from leaking from your bowel and from your bladder, okay? These muscles play a role in sexual function, and they also help to stabilize your low back, your hips, and your pelvis. So as you can imagine, these muscles do a lot, okay? And especially during pregnancy, they tend to do even more because they're now having to hold up the weight of a growing baby in the uterus. They're also having to stabilize the low back, the hips, and the pelvis more because of that laxity in the ligaments. So what we tend to find in the pelvic floor musculature, especially during pregnancy, more so in the later stages, but it can happen at any time, is that these muscles in the pelvic floor tend to tense up because they are overworked, right? Just like any other muscle in our body, when our muscles have to work hard, they tend to tense up and just hold on for dear life. So the same thing happens in through our pelvic floor. The challenge with that is that that can then cause some symptoms. So the most common types of symptoms that we get in through the pelvic floor, and this more commonly through pregnancy, but also might occur afterwards as well, incontinence. So any leaking at all from the bowel or the bladder is considered incontinence, even if it's just a dribble. It doesn't mean full loss of control. And that might be commonly with sneezing, coughing, jumping, running, anything like that. So those are some things that might cause some incontinence. Some people may experience incontinence kind of randomly, kind of just throughout their day. Another type of incontinence is urge incontinence, which is having a hard time getting to the bathroom on time. So you get that urge that you have to go and you just can't quite make it to the bathroom on time. That is also considered incontinence. So incontinence is one of the symptoms that the pelvic floor isn't functioning 100%. Another potential symptom is that you have kind of low back, hip, or pelvic pain that seems to not be fully resolved by other methods of treatment. Because the muscles in through the pelvic floor here attach in through the low back, the hips, and the pelvis, they also can refer pain to those areas as well. So sometimes where you're feeling the pain is not the actual source. That area is not necessarily the issue. It might be coming from elsewhere. And so in that case, it may be the pelvic floor. Another common symptom of pelvic floor dysfunction is pain with intercourse, or any type of issues returning to activity postpartum too, if you're getting any issues or concerns with that. So all of that kind of stuff can relate back to the pelvic floor. So as you can see, these are pretty big concerns for a lot of people. Like if you're having issues, if you're having pain with intercourse, if you are leaking, and you don't want to be leaking, of course, right? These are things that really affect and impact our quality of life and our daily activities. So addressing and assessing the pelvic floor is super important, and I highly recommend it to everyone, regardless of what stage you are in pregnancy, if you are postpartum, and regardless of how far postpartum you are. I'm a firm believer in once postpartum, always postpartum, right? Once you've had a child, whether it is vaginal or cesarean, your pelvic floor has been impacted. Okay, so regardless of where you're at, I highly recommend having your pelvic floor checked to see what the status is. It might be totally fine, which is awesome. You're good to go. Or you may not be experiencing issues, but we find that there are some things that you would benefit from working on to help prevent issues later on. So that is essentially kind of the pelvic floor, some of the main functions of the pelvic floor, as well as some common concerns or issues that we see arising from dysfunction of the pelvic floor. So yes, Connie, pelvic floor physiotherapy is usually covered by benefit plans. It is under physiotherapy. So regardless of whether, when you're going to see a physiotherapist, if it's someone who is trained in pelvic floor physiotherapy, it is billed under physiotherapy as well. So that answers that question. In terms of, sorry, how often do you need to see a therapist? Okay, so that's a really good question. And unfortunately, it varies. It's hard to give a really firm, consistent answer with that. I would say it really depends on what is going on in your pelvic floor. So I've talked before about kind of dysfunction in the pelvic floor. So a lot of people, you know, you might think that, oh, maybe my pelvic floor is weak. That's why I'm experiencing incontinence or pain or anything like that. There is the flip side to that. Maybe the pelvic floor is too tight, and that's why you're experiencing those issues or concerns. So I want to talk a little bit about kind of, there's this myth out there that a lot of people think that, okay, I'm leaking, so I need to do Kegels, right? I'm sure a lot of you have heard that, right? That, you know, Kegels are the answer. If you're having any issues, do Kegels, do Kegels. I'm here to tell you that that is not universally true. It may be the case for you that that is what you need to do, but it might also be the case that that could be making it worse. So the reason for that is this: your pelvic floor, like any muscle in the body, has a full range of motion, right? It is most functional when it has access to that full range of motion. Now, if you can imagine, if your pelvic floor is sitting in a state of tension, right, it's already super tight, and then you sneeze or cough, and that puts extra pressure on your pelvic floor, and your bladder is maybe on a little bit of a full side. If your pelvic floor is already tight, and what you naturally want it to do when you sneeze or cough is tense up, right, to help prevent leaking, but it's already too tight, it can't do that. That extra pressure then causes leaking through, because the pelvic floor can't contract against that extra pressure. Whereas if your pelvic floor is a little bit more relaxed and has utility of the full range of motion, then if you sneeze or cough, you can squeeze, and then that prevents the leaking from the bladder. So going, kind of encompassing all of that, thinking about that, if you can imagine, if your pelvic floor is overly tight and you're leaking, do you think that doing Kegels is necessarily the answer? Most often in those cases, the answer is no. So in that case, what you really want to do is you want to relax your pelvic floor before you then can regain the motor control and full function of your pelvic floor so that it can do what it needs to do for you. So that is why kind of that general statement of, you know, Kegels fix incontinence is not necessarily the case. If you are experiencing incontinence because you have a weak pelvic floor, well then, yes, then we do want to work on Kegels. But if you're experiencing incontinence because your pelvic floor is already too tight, then no, you do not want to do Kegels yet. You want to relax it first before you then work on that motor control. So yes, Jennifer, thank you. Perfect segue there. So what can you do to relax the pelvic floor? So the best way to really connect with your pelvic floor is by doing so with your breath. Now, I know that may sound very strange and very weird. How is your breath and your diaphragm connected to your pelvic floor? Well, I'm going to kind of paint a little bit of a picture for you here. So your diaphragm sits in a dome shape when you're at rest, okay? As you inhale, your diaphragm flattens downward, okay? That then increases pressure on your abdominal cavity. So your pelvic floor lengthens downward as you inhale to help kind of address that increase in pressure. As you exhale, they both come back up. So they work synergistically, okay? So as you inhale, they both come down. As you exhale, they both come back up. So really the best way to connect with your pelvic floor in to get control over it, but also to really relax it, is to connect with your breath and to do it well. So what I'm going to have you all do is, if you're able to, I want you to place one hand on your chest and one hand on your belly. Okay, so I'll lower this here. So one hand on your chest and one hand on your belly. And what I want you to do is, as you're sitting there, I just want you to just breathe normally. So just take a couple of breaths. It doesn't have to be deep breathing. And I want you to pay attention to what you feel in your hands. Do you feel one hand moving more than the other? Or do you feel them moving the same? So now that we're kind of breathing naturally and quietly, quiet breathing, what I want you to do now is I want you to take some deep breaths for me. So take a nice deep breath. And I want you to again pay attention to your hands and see how your hands move as you do that. So again, is one hand moving more than the other as you're doing that breathing? What you may find here is, if you find that in that, with your hands in that position, if you're feeling that the hand on your chest is rising more, it's more dominant than the hand on your belly, then what's happening there is you're not utilizing your diaphragm to its maximum capacity. Your diaphragm's job, it's a big muscle in your abdomen, and its job is to help you breathe. So what you really want to do is pay attention to your breath there and see if you can encourage your belly to expand a little bit more as you inhale. So think about sending that air nice and deep into your abdomen. You can even think about sending it all the way almost to your pubic bone here in front. So as you inhale, send the breath really, really deep and see if you can encourage your diaphragm to move a little bit more. Now, if you're accessing your diaphragm that way, as I explained before, the natural movement of the pelvic floor and the diaphragm is that if you're utilizing it, the pelvic floor is going to naturally lengthen down a little bit. That helps to lengthen the pelvic floor. So that is the best way that you can connect to your pelvic floor and to help relax your pelvic floor, is by doing deep breathing, but making sure that you're using your diaphragm to do so and focusing on sending that breath deep into the pelvic floor. Sometimes what's helpful along with that, once you really kind of get that well-rounded in your body, is connecting with that breath, is to try and then connect it to your pelvic floor. So when you're inhaling, visualize your pelvic floor opening up and lengthening as you inhale. And as you exhale, it just kind of quietly comes back. Okay, so you're not forcing anything, you're not bearing down, you're not squeezing, nothing like that. You just inhale and visualize it relaxing. And as you exhale, it comes on back up. Some people talk about this as like the flower breath or the blossom breath. You can visualize your pelvic floor like a flower, and as you inhale, it opens up, and as you exhale, it just kind of quietly relaxes. Okay, so that is the best way to connect with your pelvic floor and to relax your pelvic floor. I like to say it's almost like a yoga flow for your pelvic floor, right? So say you wake up in the morning and you're kind of stiff, you do a nice yoga flow and it helps to just loosen and limber things up, right? So in terms of that, is when you take your pelvic floor through this gentle breathing range of motion, that is a yoga flow for your pelvic floor. You're getting blood flow to the area, you're gently moving it, mobilizing it. That helps to relax your pelvic floor. So I know that might be a little bit of an exaggerated explanation for it, but that is the reason why we need to connect with our breath, why it's so important, as well as that's how you relax your pelvic floor and really connect that way. So in pelvic physiotherapy assessment and treatment, we do assess for that specifically, and we look at how that connection is working. So I just had a quick question here. Where do I work out of? I work out of Newmarket at West End Mamas in Newmarket, and I also work in Keswick at Anchor. So I also provide you guys with kind of with an email address at the end. So if you have any questions, feel free to shoot me an email, and I'm happy to answer that there. So that's essentially the kind of relaxing the pelvic floor and connecting to it in that sense. So I talked a little bit about kind of pelvic assessment and treatment. So I'm going to describe a little bit about what goes on in that, because a lot of people are unsure. You may have heard, you might have friends or family members, or you yourself might have gone before. But I'm going to explain a little bit about what goes on in assessment and treatment. So Obviously, we sit down and we take some time to talk about function of your pelvic floor, your core, any specific concerns that you have. We'll talk about your pregnancy history, if you've been pregnant in the past. We'll talk about your labor and delivery as well, if you've had a child in the past, because that gives us a lot of information about what your pelvic floor has gone through. Once we talk about all of those types of things, obviously we'll touch on what your main goals are. What do you really hope to achieve by coming in for an assessment and doing treatment? And then we assess externally first. So I look at how your back moves, how your hip moves, how your core is functioning. We do some specific tests catered to if you're having any specific like low back or hip pains, we'll do some special tests to determine are there certain things going on there that we need to address. But in order to most accurately assess the pelvic floor, it is an internal assessment. So I do wear gloves. I use a standard medical grade lubrication. And what we do is you lie down on the bed, you're draped, okay? And I insert a finger into the vagina and I palpate the muscles of the pelvic floor. And so what I'm looking for in this, while I'm palpating here, is I want to see what the tension is like in your pelvic floor, as well as if there's any associated tenderness that you feel with that tension. I also want to know what your ability is to relax your pelvic floor. So how do you connect with the breath? And that way I can actually palpate and feel, you might be breathing with your diaphragm, but is it translating to your pelvic floor or not? And we'll work on that together to get you doing that well. Then I also like to assess the strength of the pelvic floor and determine where you're at in terms of that. And the way that we assess the strength is essentially by doing a Kegel. And so I want to see, are you getting the squeeze as well as the lift that we're looking for with the Kegel? What is the strength like? What is the endurance like? Can you breathe while holding the Kegel? All of these things are really important to know to determine the overall function of your pelvic floor and the control that you have on your pelvic floor. Then from there, we determine, okay, these are specific things that we need to work on to help you address your concerns and to help to improve the function of your pelvic floor. And then I'll give you exercises that you can work on at home to help address those specific scenarios. So going back to that question about typically how long does it take for symptoms to resolve, it really, really varies. It really depends on what your concerns are, what the status is of your pelvic floor, and from there, what we need to do to move you forward. So if you're the type of individual where you're just coming in to see where it's at, you don't have any specific concerns, you just want to see where your pelvic floor is at, we assess and everything seems good, then it might be just a couple treatments just to make sure you're connecting well, your core is good, and then you can go on your way. Whereas on the opposite side of the spectrum, if you're experiencing symptoms and you're having a really hard time just connecting with your pelvic floor, because let's be honest, it's something that we don't often think about, right? Not all of us think about it on a regular basis. So sometimes even just building that connection takes a little bit of time. And then if we need to improve your strength and your endurance and function and get you back to your activity, say you're wanting to get back to running or something like that, well, that might take some time. So it really does vary, but know that it is catered to you specifically. It's not a blueprint. It's not a template that we use for every person. It is catered specifically to you, your concerns, where your pelvic floor is at, and how we can get you back to where you need to be. Okay, so I know it's not an awesome answer for that question, but it really does depend for that. So is uncontrolled gas a symptom of a weak pelvic floor? Yes, it absolutely can be. And because the pelvic floor encompasses the vagina as well as the rectum, right? So if you're having a hard time controlling gas, then that is something else that we can address. We can see pelvic floor wise, are things a bit too tight, which is why you're having a hard time controlling it? Or are you having a hard time controlling it because you can't connect with the pelvic floor too tense up to try and hold in the gas? So in those cases, if you're experiencing kind of issues with gas, issues with bowel control, or sometimes tailbone pain is common as well. If you're experiencing those types of things, in that case, it would be warranted to also do a rectal exam. So again, in that case, it's gloves, standard lubricant, okay, and inserting a finger into the rectum to palpate muscles of the pelvic floor rectally. The reason for this is because sometimes the muscles that we can palpate vaginally, you cannot access muscles that and so you need to palpate rectally as well to access specific muscles for that. So that is something else as well that we can address if those are some specific concerns of yours. Yeah, so a little bit on bloating and pressure for sure. So I love to work with as a part of an interdisciplinary team. So as a pelvic health physiotherapist, I do know some about, nutrition and how we can make sure, like if you're experiencing constipation or anything like that, we talk about hydration and fiber intake. But if it goes beyond in terms of symptoms of bloating and that kind of thing, then I often refer out to a naturopathic doctor to have that conversation specifically to see if there's anything diet-wise that may be contributing to what's causing the bloating and the pressure. However, pelvic floor-wise, if it's that bloating and pressure that is causing you challenges in terms of holding in the gas, then we want to still assess the pelvic floor and see what's going on there that's preventing you from being able to control that for sure. So the other piece of that pressure, again, I'm not sure if this is specifically for answering that question, but pressure wise, we do want to reduce any straining or unnecessary pressure on the pelvic floor. So that includes if you're constipated, kind of bearing down to have a bowel movement. We want to avoid that as much as possible, as well as if you're doing any type of lifting or when you're working out, you want to try and limit, you don't want to hold your breath when you're exercising, okay? When you hold your breath, that increases pressure in your intra-abdominal cavity, which then just puts more pressure on your pelvic floor, which then strains things that way. And that might be contributing to some of the issues in terms of the difficulties of control of the bowel or bladder or pain or anything like that. So pressure wise, those are some things that you want to manage. You want to make sure you're breathing while you're exercising. Mainly you want to try and exhale as you exert yourself to prevent that increase in pressure on the pelvic floor. And then along with that, when you're having a bowel movement, if you're straining, you want to try and avoid that altogether. So doing some deep breathing to relax. Some of you may or may not have heard of a squatty potty, which essentially is a stool that you place your feet on the stool to help elevate your knees above your hips, which helps to relax the muscle in the rectum that naturally kinks the rectum. It helps to relax that muscle a little bit more so that when you have a bowel movement, it's easier to pass through, so you don't have to strain as much. So again, these are all things that we talk about during our session that we go through if this is a specific concern for you. And we do put the pieces together, right, based off of what symptoms you're experiencing, and then what do we find in the pelvic floor, and we put that together and determine, okay, this is where we need to go and what we need to work on for there. Okay, so another question here. So after vaginal delivery, how do I know if my pelvic floor is tight or tender if still having pain and incontinence? Yes, so that's a really good question. And to be completely honest, it's hard to know without fully assessing. The reason for that is because, as I explained before, it's super common for the pelvic floor to be a little bit more in a tense state during pregnancy. After delivery, it doesn't magically just kind of fix itself all the time, right? Although we'd love it to do that, it doesn't. So it might be the case that your pelvic floor is still a bit tight, which may be contributing to pain and incontinence. The other side of that is it might be from having the vaginal birth. The tissues have been stretched, right? There might be some tears as well that you're dealing with, and some scar tissue, which is affecting the function of the musculature in the pelvic floor. So to assess that and see maybe the case is the other side of the spectrum where the pelvic floor is a little bit lax and you're having a hard time really connecting with it because of that labor and delivery. And we just need to work at that side of things. So to really truly know if it is on the tight side or on the weak side, the gold standard is having an assessment done. That's really the best way. If for some reason you're unable to get an assessment done, you can't come in for in-person stuff. We do also offer virtual. I do also offer virtual sessions, but of course that does limit the full assessment capability. What I often recommend in that case is, whenever in doubt, start with the breathing to relax your pelvic floor. Just in the event that you are overly tight, it helps to address that side of things. So do that for a little bit and then see if your symptoms improve. If your symptoms improve, well then ding, 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 your pelvic floor was too tight. If your symptoms don't improve, then maybe try doing some Kegels and see if that helps. But again, I'm going to keep coming back to, it's really best to have it assessed because not everyone does Kegels properly. You might think that you are contracting and isolating and doing it well, but I've actually had several clients where I cue them to tense up and tighten, and they actually bear down instead. And then I give them the opposite cue. I'm like, okay, so bear down, and that's when they tighten. So it's hard to know what really is happening in your pelvic floor without actually assessing it. So it's, those are kind of some general guidelines you can follow, but it's definitely not a fix-all by any means. It is best to have it assessed in terms of that. So you're welcome. So in terms of when and why you want to see a pelvic physiotherapist, if you are experiencing pain with intercourse, please, please, please do not think that even if from day one, if you've always had painful intercourse, do not accept that as the norm. That is not necessarily the case. There are a lot of things that we can do if you're experiencing painful intercourse, okay? So if you're experiencing painful intercourse, please, please, please see a pelvic physio. If you're getting incontinence of the bowel or the bladder, even if it's just a tiny little bit of leakage, please see a pelvic physio. If you are experiencing low back, hip, or pelvic pain that doesn't seem to be resolved by traditional therapy measures, whether it might be traditional physiotherapy or massage or chiropractic or osteopath, anything like that, please see a pelvic physio, because it might be coming from your pelvic floor. And that might be part of the reason why it's not being addressed, because it's coming from the pelvic floor. So you want to see that there. So those are kind of, if you're experiencing, so postpartum wise, if you are wanting to return to activity and you're just not quite sure, see a pelvic physio. If you're worried about abdominal separation, yes, we do address that in pelvic physio. That is definitely 100%. I assess that in every single postpartum mama. We look at the core and see, is it functioning well? Do we need to address anything specifically for that? If you're wanting to return to activity and you're not sure about that, come on in and see someone. Anytime you're experiencing any heaviness, pressure, or pain in the perineum. So when I say perineum, that is like the bottom area of the pelvic floor here, okay? If you're experiencing any pain or pressure or heaviness in the area, come on in and we'll take a look and see what's going on there as well. So those are some key points when you would want to reach out to a pelvic physio and have an assessment done to determine if there's something pelvic floor wise that needs to be addressed, okay? So yes, it's so true. Oftentimes after delivery, whether it be vaginal delivery or cesarean section, there might be a fear around resuming intercourse, which is understandable, right? Your body has gone through an experience, and it is a traumatic experience for the tissues, right? The tissues have had to go through some things, whether you had a major abdominal surgery, or you had to, or there were some tears, or even if you didn't have any tears with the vaginal delivery, your tissues still had to stretch in response to that. So it is normal and it's common to have some anxieties and fears around returning to intercourse afterwards. If again, we can assess and see prior to resuming intercourse, if you want, we can take a look and see, listen, is there tenderness here? Are there some things that we can do to address that, to give you more confidence that it can be a more comfortable experience for you, of course. So again, we can definitely address that as well. And touching on cesarean section too, a lot of women think that because you've had a cesarean section that your pelvic floor is fine. Again, let me bust that myth for you. That is not necessarily the case. Think about it this way. Your pelvic floor, one of your pelvic floor's jobs is to hold up the bowel, bladder, and uterus, right? That includes the growing weight of baby. So your pelvic floor still had to work overtime the whole time you were pregnant, right? Then when you think about the surgery that you go through, you cut through some abdominal tissue. The muscles in the core are separated. There's scar tissue then that forms after healing along that C-section scar. All of that can also impact the pelvic floor. So again, regardless of whether you had a vaginal birth or a cesarean section, it is important and it's beneficial to see a pelvic health physiotherapist after delivery. I got to tell you, they have things figured out over in Europe. I think in France, every woman gets, I want to say like 6 to 10 treatments postpartum covered by the government to help them get back to full function in terms of pelvic health physiotherapy. We're not there yet. OHIP, there are some clinics that do have OHIP coverage for pelvic physiotherapy, but not very many. There are only specific clinics that are allowed to provide that. So more often than not, it does come out of your pocket or out of your extended healthcare benefit plan, if you have one. So to answer the question, how much is pelvic physiotherapy? It does vary from place to place. I would say kind of going rates for an assessment are anywhere from probably $130 to $150 for an assessment, and that's usually about an hour. And then for treatment times, or for treatments, again, that probably varies anywhere from 80 to 100 for a treatment session. And those are usually about half-hour sessions. So that is around the cost. You can call around your area and see what the cost is. And there may be some OHIP clinics in your area as well, but you'd have to kind of look up that. I don't know all the OHIP clinics around Ontario, but yeah, it's definitely, it's not something that's covered by OHIP everywhere at this point in time. Do you need a referral? No, you do not need a referral. We are frontline practitioners, so you don't need a referral to come see us. However, your insurance plan may require a referral to be reimbursed. So check with your insurance plan first. But any physiotherapist, pelvic floor or not, you don't need a referral to come in and see us. We're frontline, you're able to come in, we're direct access, okay? Sorry, answer that question again. No, you don't need to be referred by a family doctor. Sometimes people like to go to their family doctors when they have these types of concerns. I gotta say, we're trying really, really hard to educate family doctors, midwives, and OBs everywhere around that number one, pelvic physiotherapy exists, what it does and how it can help, and when to refer to us in the event that people out there don't know about it. So we're trying really hard to get it out there a little bit more. It's getting a bit better, but there's still some work to be done. So we're making our way through. So yeah, that's kind of along that sense. That's kind of what you're looking for there. Okay, so let me just go back to some of these questions here. So I feel like I've answered how do you know you need to work on your pelvic floor. We've kind of talked about it's best to assess, but you definitely want to try and connect with your breath. And then if that's all good, then we want to see about the Kegels. Rebuilding your pelvic floor after childbirth. So yes, definitely you want to get that function back, right? Whether or not you're experiencing any issues or concerns. So it really will, it really will kind of boil down to what is your current state of the pelvic floor to determine what we need to do in order to rebuild. Do we need to relax first before we strengthen? Or can we jump right into strengthening? And then how does that connect with your core as well for overall functioning and getting back to activity, exercise, what it may be. So the best thing to do for that is to, again, have an assessment to see where you're at in terms of things. And then we can cater it to you specifically, as opposed to just following kind of a blanket general plan, which, may or may not be best for you at that time. So yes, we talked about if Kegels help with incontinence, maybe not. So again, you need to kind of get assessed to see. Is it too late to work on it 10 years later or years later after kids? No, it is never too late to work on your pelvic floor. Let me tell you, so research does show that pelvic floor physiotherapy is the best level of evidence to support getting pelvic physiotherapy to help prevent incontinence later on. Okay, so if you can get pelvic physiotherapy while you're pregnant, that will help with your connection postpartum to help prevent these issues from getting worse. But also years down the road, it is super common for women to not experience many issues until like 7 or 10 years after they're done having kids. Oftentimes when we go through menopause, as our hormones change, as our tissues start to change, that's when a lot of these concerns and issues start to arise. So if you can deal with it now, address things now, you'll benefit from it later on in terms of that. So that's definitely helpful for that side of things. Preparing for birth, pelvic floor wise, definitely a huge role in that. Whether you're experiencing issues or not, we can do specific things to help prepare your body for labor and delivery to help try and prevent the chances of tearing. If it does end up being a vaginal delivery, to help you recover quicker afterwards, to build on that connection with your pelvic floor so that you can hone that connection so that afterwards you can pick it right back up again. So definitely a huge role for pelvic physiotherapy during pregnancy as well. And if you've never been pregnant, or if you're not planning on having kids, it's also important. It's also a great thing to have assessed to see where you're at to help prevent issues that may arise later on down the road as well. Yeah, so still leaking on panty liners throughout the day. Yep, so 4 months postpartum. So body still kind of the healing process is a long process. So for those of you who have gone through it before, you might recognize that it does take time. Think about all the changes that happened to your body through that whole time that you were pregnant. That took 9+ months, right? Now, immediately afterwards, a lot of us just kind of expect to just snap back, bounce back, whatever you want, whatever term you want to use, but your body needs time to heal. And so that's fine. Give it time to heal, but you also want to address these concerns and issues early if you can to help prevent it from getting worse or developing bad motor patterns or habits and whatnot. Okay. Yeah. So getting a little bit of peeing when you sneeze, even if it's just a little bit, still, I mean, it's totally up to you whether you want to get it addressed. If it's not that big of a deal, I just wear a liner and you're kind of okay with that, well, that's up to you. I would still recommend though, having an assessment done because it may turn into a larger issue later on down the road if it's not addressed, even when it seems to be minimal or minuscule. So it is still a good idea to assess and see what's going on there. Okay, had your second baby 7 months ago and now experiencing some pain with sex, wondering if it's pelvic floor related. It very well could be pelvic floor related. It might be that tissues are tense. It might be an issue with scar tissue, whether cesarean or vaginal scar tissue, that's not allowing the tissues to mobilize well. And then with intercourse, that's causing friction and discomfort. So it very well may be. So again, if you've tried other things and it hasn't made a difference, then definitely get it assessed. I know some people are just like, oh, just try some wine, or, oh, just use some lube, try different positions, try those things. But like, if it's not making a difference, then definitely get it assessed. There likely is something else going on that can be addressed in terms of that. Let's see here. Yes, so a VBAC or a vaginal birth after a cesarean is definitely an option. It really depends on the reason for the cesarean section. And so that's where your midwife and your OB or your family doctor, whoever is following you for your pregnancy, would determine kind of what would be the best option for you moving forward. But it's possible. I did it. You can do it. Good luck. Okay, let's see other questions here. Is diastasis recti, that's abdominal separation, okay, associated with the pelvic floor? It's not necessarily, I wouldn't say it's associated with the pelvic floor, but the core as a whole encompasses the diaphragm, the pelvic floor, and the abdominal muscles all the way around. So the pelvic floor and the core and the diaphragm all can contribute to diastasis recti if things aren't functioning well together. So it is, and a pelvic health physiotherapist can definitely assess for that and help you move forward with that as well, for sure. Other questions here? So I think I answered those ones. Keep throwing your questions down there, guys. We have about 10 minutes left. Okay, let's see here. If I want to have another baby, but I have this problem, oh, how much is a pertinent time to wait? Okay, so I'm not sure what problem you're talking about. If you're wondering if it like there's incontinence or whatnot, that type of thing. Ideally, I mean, you can still get pregnant and work on things during pregnancy. Absolutely. If you are, I wouldn't necessarily use that as a reason to wait to get pregnant if you're really wanting to have another child. There are things that you can do to work on it. What I would say, honestly, to answer that question the best would probably be get an assessment done to see where you're at. And then that will determine how much time or what would you benefit from. Should you wait maybe a little bit to get a little bit more control over your pelvic floor before you move into the next pregnancy? Or are you kind of okay to work on it while you're pregnant? That's another option too. You can still work on things through pregnancy. Yes, it changes things a little bit, but you can still work on things during pregnancy. Okay. Yes. Okay. So a vaginal delivery a year ago and had a 3rd-degree tear. OB recommended to see a pelvic physiotherapist. Found out pregnant again. Congratulations. And thought it might be a good idea to see a physio before delivering again. Absolutely. I definitely think that's a fantastic, yes. I do. That's a good idea. I would recommend that for sure. Just to assess and address things and help prepare your pelvic floor for the pregnancy, for the next delivery, all of that kind of stuff. Definitely a really good idea to check in for sure. Okay, so someone's asking here specifically for me, if I was induced for my VBAC, if I had epidural, if I had any tearing in my cesarean scar. Okay, so my first, like I said, was a cesarean section, and that's because he was breech, and we didn't know that until I was already 5 centimeters dilated. My water had broke, and everything was already happening. So with that labor and delivery, it was an emergency C-section. They rushed me in. I was with midwives, and at least my midwife specifically, didn't want to deliver breech, so I was transitioned to an OB, and they did a cesarean section. So for that, I had the spinal for the cesarean. For my second, they were 2 years and almost 4 months apart in age. And so for my second, with the VBAC, no, I was not induced. Actually, with both of my babies, my first, I was 3 days early. With my second, I was a week and a half early, estimated due date. It really is just an estimate, but I was early, and my water broke naturally at home with both of them. So I did not have to be induced. I did get an epidural for my second one. My labor was not progressing as well and was on the longer side. And so they did have to kind of augment labor with some medication. And so I opted for the epidural at that point because I needed to rest. And I did not have any tearing in my C-section scar at all. Oh, no, I answered that. That's fine. She wrote afterwards. I could answer privately if I wanted, but no, that's fine. All of you now know, and that's fine with me. It doesn't matter. Okay, so what exercises can have a negative impact on a weak pelvic floor? So that's a really good question. So if it is truly a weak pelvic floor, and it's not weak because it's masked by tightness, because that's another thing that can happen, is if it's overly tight, it can present itself as weak. So if it is a truly weak pelvic floor, things that can have a negative impact on that is if you are bearing down, if you're holding your breath, if you're not breathing well when you're exercising, because what that's doing is that's putting more pressure on the organs and it's pushing them into the pelvic floor. And so that can create issues later on down the road with like prolapse and things like that. So if you have a weak pelvic floor, you want to make sure you're not doing those things. You want to breathe well. You want to not bear down. And then in that case, you want to try and do some Kegels and strengthening to augment the strength of the pelvic floor. So how long does pelvic floor therapy usually take, the healing and whatnot? So that really depends on what's going on in the pelvic floor. I've had women who've had vaginal deliveries and, second degree tears, who have really only required a couple of sessions. Their body has just healed well. I've had other women who've had no tears, but have still had issues with recovery, reconnecting with their pelvic floor that have needed a longer period of time for treatment and whatnot. So I would say it really could vary from, a couple of treatment sessions to, 6, 8, 10 months of treatment. Again, once we get into the later stages, I'm not seeing you every 2 weeks or weekly or anything like that. It's usually more about, okay, let's give you exercises to work on to come back in like 3-4 weeks or longer to kind of see if you can manage on your own well. Okay. So I know that's not a very direct answer, but that's really kind of the best I can get. Yes, I did have a midwife. Both times. Same team both times. It was a good experience. They were great. They're encouraging epidural right now because of COVID. Really? I did not know that. I wonder why. That's kind of strange. They also have mentioned induction because of gestational diabetes. Yes, that is common. It's common to talk about potentially being induced if you have gestational diabetes. Main reasons is because they might need to get labor going early if they find that if they're worried about baby getting a bit too big, right? Different things like that. So it might happen. It might not, but they often talk about it just in case. Okay, good question, Liz. So is belly wrapping okay if you're working on your pelvic floor? So belly wrapping is, I haven't found any evidence that is really concrete that's like, yes, it's really good for you. It really depends. You'll find practitioners out there that are like, yes, do it. It's awesome. There are other practitioners that'll be like, no, don't even touch it. Just do whatever. The main thing with that is just to be aware that you can still breathe well, because you don't want to increase pressure on your pelvic floor if the belly is wrapped too tightly, right? So you want to still be able to breathe well with it on, and not to have it constricting your breathing pattern at all. True, yeah. Well, yeah, I guess after epidural, yeah, they'll get you to the hospital a bit quicker. All right, can you speak more about how glute and back pain might be associated? Yes, okay, this will probably be my last question because you have 2 minutes. Okay, so glute and, success using a belly wrap as a prop for specific people. Yes, but everyone is different. It's true, yeah, some people, it's great, other people, it doesn't make a difference or not helpful, so it really does depend. Okay, so speaking about glute and back pain, and why it may be associated with the pelvic floor. So going back to those muscles in the pelvic floor, These muscles here, as I said earlier, can refer pain to other areas. So sometimes what you'll notice is when I'm palpating internally, I'll press on an area and you might feel that in your glute or in your back or in your hip, even though I'm pressing on the pelvic floor, right? So, so while you might be having back pain or glute pain, it might not be your back or glute that's the issue. It might actually be coming from the pelvic floor. A different side of that is that if your core is not functioning well, that can contribute to glute and back pain as well. Again, the core is the diaphragm, all the muscles around your abdomen, as well as your pelvic floor. So if you're not functioning well there, that can affect and cause some glute or back pain as well. So that is how you kind of dial it into the pelvic floor. It really is, we can't look at you in a silo. We have to look at all of the pieces to determine what's going on there. Awesome. Well, guys, thank you so much for all of your questions. Yes, there probably is some work to be done on the core, so you can get working on that. That's no problem. Thank you so much for your questions. I really appreciate you guys being so interactive. That was great. I'm going to type in my email address here. I can't do it while talking, so hold on. Okay, so that's my kind of generic email address. Oh, sorry, I sent it just to one person. 1 second. Oh, is it not letting me send it to everyone? Oops. No. Oh dear. Let me try this again. Alison Ribeiro. There we go. That went to everyone. Sorry, disregard that earlier email there. That is my email address. If you have any questions, please feel free to send me an email. Again, I work out of Newmarket at West End Mamas and Anchor in Keswick. So if you want to come see me specifically, that's where I'm at. But again, reach out if you're not local to this area, reach out to anyone else nearby you that's a pelvic physiotherapist. They will be more than happy to help you out through all of this stuff. So I hope what you guys found today informative and interesting. Again, I really enjoyed chatting with you guys. Thank you for being so interactive. And yeah, hope to maybe see you guys around. All right, take care. Bye.